Well, hey, everybody. Welcome. I'm Nina Crowley. I'm your host. I'm the Director for Clinical Education and Partnerships at SICA, and we partner with healthcare providers to offer body composition solutions. Today, I'm so excited to be joined by Dr. Eric Crall, who's the owner of MyDPCdoc Family Medicine in Florida. And Dr. Crall has a direct primary care practice. He's one of the early adopters of direct primary care. He's going to tell us all about that today. And he's a big fan of body composition analysis. So I wanted to talk to him more about how he's using it in his practice. He's got a physician-led network providing DPC for employers. And he's going to the upcoming HINT meeting where SICA is going to be this year. And so I really wanted to hear more about that meeting, especially since I can't be there myself. I wanted to get a preview, and it sounds like there's a lot of innovation and excitement at that meeting. So I think it's going to be a great one. So welcome.
Thank you.
Well, I think we have a lot to talk about today, but one of the things I first wanted to get into was just a little bit more about direct primary care. My background in coming from an academic medical center with a lot of red tape and a lot of a lot of things that I think drive people out of that system. So I don't have as much personal knowledge about it, but I know that you've been in it for 10 years and you've got a lot to say. And I think, as you've said, they're achieving scale and they're, even in getting involved with lifestyle medicine. So there's really a big push to some of this stuff and meeting people for where they're at and what they want. And I'm seeing a lot of body composition. So let's talk about how you got into it and a little bit more about direct primary care.
Yeah, it's a very exciting time because there's a lot of sort of converging trends that are happening separately. The direct care movement has come about as we've started to focus more on preventive medicine, obviously with the internet explosion and then the information and it perfecting treatment of disease. But as a country, there's a greater push now towards prevention. But the way in which primary care is done is not suited for prevention. You can't do a lot to work with people on their nutrition and exercise in a 7 to 10 minute office visit. So direct primary care, really came on the stage probably 15 to 20 years ago. But 10 years ago when I started, there were only about 400 practices. Now there's over 9,000, depending on which data source you use, and roughly
Wow.
10% of primary care doctors in this country are now direct primary care doctors, depending on which source. So it's something which allows the physicians to, as we say, really rediscover the joy in practicing medicine, because you can spend an hour with your patients. You really know them. You get into their family history. And first and foremost, you are actually addressing the root causes of their chronic conditions by helping them with the optimization of their nutrition and exercise, and even sleep and stress. It all comes into play.
Absolutely. Well, yeah. So that's huge growth, 400 to 9,000. And it sounds like, one of the primary conferences in this space. And as you said, the primary, electronic medical record or portal. So you might have to educate me a bit more on that. But HINT is where everybody converges to go and learn and kind of, connect and talk more about this. Is that right?
Absolutely. Hint was the first one on the stage with the software that is unique for direct primary care. It
Software.
really is. It's a
That's the word
monthly,
I was looking for.
yeah, and the model doesn't get any easier. It's just a monthly subscription. So, they perfected sort of the gym membership management software. That's one of our
Mm.
analogies. DPC, it's like a gym membership. So literally coming up on 10 years ago, the people at Hint really worked with those of us in DPC to make sure that the software platform was functioning like we needed it to. And they were they were savvy enough to realize that if they developed the entire ecosystem, everyone would benefit. So the EHR platforms that cater to DPC, the most common ones are integrated with Hint, and the communication platforms are integrated. So when I say that the entire ecosystem around DPC has really evolved within the Hint ecosystem, that's a very true statement. There are certainly other platforms that are emerging and are beginning to achieve some scale as well, but Hint was the first. And the Hint Summit that I'll see you at later this month. That is
Not
the
me, my team though. I want to be in Colorado, but
well. I look
but the
forward to
team will be
seeing.
there.
Yeah, that really is sort of the event in DPC because of all the vendors that are live in the DPC space. Everybody goes there.
So it's a couple days. It's in Colorado. What are
It
you
is.
excited about? Do they have a few keynotes that are going to be, stuff you're excited to hear about? You've got to educate me. I really don't know much about this meeting.
Yeah, it's the networking. I mean, I've been doing this for 10 years, so I don't need to go there to learn how to do DPC. But sort of one of the biggest elements that we're trying to scale this movement to employers. So one of the most valuable elements of the Hint Summit is really talking a lot about the ways in which we're all trying to, cater to employers and, you know, how to collect the data that shows that the value of the care we're providing. So not just
Mm.
valuable to individuals and families, but how we can show our value to employers to actually scale this. So, and it's always interesting to be able to go there and network with new solutions. The list of vendors who go there, it's pretty impressive. There are things that other DPC docs are doing that I'm not aware of. And that's where I learn about it. So yeah, if you're in DPC, whether as a physician or just someone who is active in that space, that's the place to go.
That sounds great. Well, and I think one of the things you said, sharing and showcasing value to employers is huge. And so I'd imagine among some of the things that you do showcase would be some of this body composition data that you and I have talked about in your practice.
Yeah, especially as I mentioned, just this convergence of lifestyle medicine. And lifestyle medicine actually now has a seat at the table of the American Medical Association House of Delegates recognize it. So I mean, lifestyle medicine isn't just a trend or an undercurrent. Like it is really emerging because of the emphasis on preventive medicine and getting at the root causes of disease. So it's a perfect marriage with direct primary care. And so, once you start talking about the value you provide and the value in focusing on optimizing nutrition and exercise and helping people be healthy today, but also extend their health span and lifespan, we need to be assessing their progress with things that matter. Yeah, glucose and blood pressure and diabetes, we do all that. But at the highest order metric, which determines all that, is skeletal muscle mass, functional strength, and VO2 max, which, maybe save that for another podcast. But,
Yeah.
if you're optimizing people's muscle mass and, their functional strength and their cardiovascular fitness, everything else that we're interested in automatically improves. So having that as a measurable metric with a tool that is validated, correlates with DEXA, so that I can show someone, hey, you're not just overweight, you're overnourished but undermuscled. And we're never
Hmm.
going to get you to optimal health unless we evaluate the muscle side of the equation. And I guess it would be appropriate to add there that this surge in the use of obesity medications, which really is going to revolutionize our ability to manage obesity. You really need to have a individual tailored approach to those patients, because a patient who's overnourished and adequately muscled, is going to do fine with one of those medications. But someone who's overnourished and is at the fifth percentile for muscle mass, we really have to be aggressive about making sure that as we work on fat loss, that we're preserving muscle. And you can't make those assessments without having a valid tool to actually measure body composition. So that's really probably one of the biggest evolving areas that I see where using the body composition is critical for being able to individualize the treatment of the patient.
Oh my gosh, you said that so perfectly. I mean, that's really what I've been seeing in the field as well, where people are, they've been so hung up on weight and BMI for all these years. We're really seeing that push away from that, but even a push away from just simple, body fat analysis to look at that that muscle mass. And I love that that's the focus, because for me, I don't know if you know, in my background, I have my degree in health psychology. And from the psychology standpoint and people's behavior, it really matters to focus on something that is not just let's get this to the lowest number possible, because long term, it's not that exciting to stay there, right? So I think that's where I love muscle mass as an indicator too, is that that can be a lifelong goal. It is a lifelong goal, and it gets harder as we get older, something that we can continually strive to work on, but that it's not just weight dependent, looks dependent. It really has all those connections to functional health and strength and longevity, which I think is super exciting.
For sure. And before I started working with Sika, I mean, I didn't mind that my patients were bringing me in the results of their, the scale in their bathroom at home. But now that I understand, what an accurate body composition measurement really is, these home devices are telling, middle-aged women that their muscle mass is 110 pounds. It's like, I'm
Mm,
sorry, but that's physically not possible. So those are probably useful directionally to monitor trends, but
mhm.
they're just not going to allow us to tell someone where they are as a population norm. Like if we need to get them in the upper 75th to 90th percentile for where they should be for their age and sex and ethnic background. And you can't get that information with just an over the counter
Yeah.
scale that happens to spit out numbers.
Yeah, it's an interesting one, because there's sort of that sweet spot between, right, like how often you want to go into an office versus how much, people seem to have this trend and push to wanting all these data points to be done at home. But I think that there's some, we're going to land somewhere in between. And I think, like you said that very well. You come in, you do this in person with you, and then maybe monitor that trend at home. But really connecting it back to what they can do to change that number, right? So I think that's where the hour that you have with each patient, the rapport that you build and have with them, their ability to come back to you when they want, and that whole lifestyle medicine approach where you're looking at nutrition and exercise and sleep and stress and all of that holistically. I think that's really the beauty of connecting not just data and endpoint, numbers, but with the actual stuff they can do to change it.
Exactly. Yeah, we have to be following the metrics that matter. I mean, you can measure things that are useful, but you want to be measuring the things that are actually correlated with health span and lifespan. So being able to measure the metrics that are actually correlated with that are very useful.
So are you able to see some good movement in people's skeletal muscle mass when you're working with them? Tell me a little bit about that.
Oh, absolutely. There is nothing that I've found more motivating. I'll use an example in men, just because middle-aged men, seem to be very concerned about their midsection and all that. Nothing more motivating than telling a middle-aged man that he's at the 5th or 10th percentile for muscle mass. And I mean, sometimes they'll argue with me, that's not possible. I played football, blah, blah, blah. And then I'll say, well, look, your left leg is much less than your right, and you had a lumbar disc surgery 10 years ago. So they can see the results, and they actually tend to really validate them by the way that the results are reported. It's not just spitting out a number. They can tell that the results seem to correlate with where they feel stronger or weaker.
Mm.
So, I try hard to motivate people, but one of the biggest differences that I've had in getting people to do exercise is to be able to show them how under muscled they really are. Um, and also the visceral fat picture as well. You know,
Mm.
I often joke, you don't have to pay me to tell you that you're overweight or that you need to lose fat, but I want to see where your muscle mass is, because I would give you a different plan depending on how we're going to lose fat, depending on where your muscle is. And of course, the visceral fat correlates with the insulin resistance, the disease, the fatty liver, the diabetes, the cardiovascular disease. So I like to be able to show them, yeah, you're overweight and you did know that, but we didn't know that a high percentage of your fat is visceral fat, and that's what would shorten your lifespan. And so we need to specifically address that. And then, of course, as you do serial measurements every 3 months or 6 months, and you can show them that what they're doing is not just the losing weight, but yeah, your muscle mass is going up and you're getting rid of that bad visceral fat. And it's just, it's invaluable.
Yeah, that's a perfect way to put that too, because it's really, and I like how you say, you don't have to pay me to come in and tell you that, because that was what I, in my practice for so long, I would see is, hey, people, I don't want to give people 20 more numbers that tell them they're in the red, they're doing bad, they're not, they're not where they want to be, they're not where they need to be, they're at risk for everything. That was kind of a depressing situation, right? But the way you said that, we knew you were struggling with your weight. You don't need to tell you that, but here's where it is and here's what you can do, and then giving them hope and bringing them to a data point that's not just something that's um, you know kind of we don't really know how to impact your weight, or we could have you lose weight, or like you said, with medications, they are revolutionizing what people can achieve with so many different health outcomes. But I really do see that going hand in hand with being able to show them, well, where and how and what parts, and especially that individualized care that you're able to provide different for different folks, right? I mean, that's the big thing at the end of this. Like, we are all kind of working on, for the most part, decreasing body fat to some extent, increasing muscle mass if we can, and that can become sort of general, oh, this is what we've got to do: strength train and eat more protein. I've almost heard that becoming as sort of simplified as some other things. But what you're saying is you've got to look at where that is on that individual, and where their muscle is, and how close you're going to follow them, and what type of treatments you're going to recommend. And that's what really ties in that whole personalized individualized care plan.
Yeah, this is a huge point to emphasize and expand on, because people are used to hearing terms like personalized medicine, precision medicine, and that has referred to treatments like cancer treatment. We can individualize your treatment. We've never talked about prevention in terms of precision like that before, and individualizing. And so that's what assessment of the body composition, as we've been saying, allows. Because if somebody is metabolically unhealthy and they are overnourished, I'm going to give them an entirely different approach if they're at the 75th percentile for muscle compared to the 5th percentile for muscle. Because you can't, you know, get into a negative caloric balance without making sure that you have adequate strength training and adequate protein intake to support your muscle. And even just protein intake, giving an individualized goal for where they need to be at for their protein intake. There's all kinds of formulas out there. There's probably a dozen different ones, and everyone's so confused. How much protein am I supposed to have? Well, once we know your skeletal muscle mass in pounds, we have a protein prescription personalized for you. So yeah, precision prevention, that's something we've never spoken about before. And I don't think it's really possible when it comes to nutrition and exercise advice without the body composition being the metric that we're making our treatment based on and monitoring the success of treatment with. So
Yeah, I think the trending is just as important, right? I mean, you're not, especially in your practice, you're seeing, how often are you seeing patients?
at Monday through Friday, every day of the
I
week.
mean, like individually, do they come monthly, or is everybody kind of on a different
Oh, it's
cadence?
it's different. If they have a metabolic disease, it's at least every 3 months, and some of them are monthly. And people without chronic medical problems, that may just be once a year, or
Okay.
chronic medical problems that are stable, that would be twice a year. But the skeletal muscle mass, body fat percentage, and visceral fat, those are metrics which are just part of the annual wellness exam. I mean,
Okay.
something that you need to be monitoring annually, just like blood pressure, glucose, A1C. But then anybody who you're actively working on, we say losing weight, but losing body fat, we'll monitor their body composition every 3 months, maybe every 6 if they've shown good stability, but yeah, frequently every 3 months.
And that trend is just, I mean, when I do like one of the ways that we show trending over time, because I think, there's that component of motivation and keeping up with, whatever plan it is that you have them on, or that you're working towards together, being able to see that connection, I think keeps people motivated and it keeps them coming back.
It definitely does. It's rare that an individual can keep himself or herself fully engaged in healthy habits on their own. I mean, really, only the elite athletes, who are driven to compete at the highest level, are generally able to stay on track. For the rest of us, we have the best of intentions, but life gets in the way. And knowing that you're having that measurement, done every 3 or 6 months certainly helps keep on track.
I love that. Yeah, and it sounds like, I'm with you on skeletal muscle, body fat, and visceral adipose tissue really being, like vital signs, as you said, almost like these are things that we should be promoting annual assessment of, and then, designing interventions around as you see change up or down in them.
Yeah, and there's really no reason not to incorporate it into the practice. I mean, unfortunately, I'm an example of someone who didn't recognize the value that was there. In direct primary care, we have very small practices, very low overhead, and it's hard to convince yourself that something that has a certain cost burden, are you going to be able to recover that? Is it going to
Mm.
provide enough value? Because patients, they just pay us monthly. It's not volume. So I wish that I would have pulled the trigger a long time ago. I've been doing it for the last 2 years, but the finances of it are not a reason to hold back from incorporating it, because people find value in it. So you'll set a reasonable fee for it, whatever works for you and your practice. But people find value, and you're doing it often enough that it pays for itself. The cost is not an obstacle for building it in.
So how do you want to talk a little bit about your individual structure or what you've seen? Do you add that as part of the base fee? Is it, pay per use, or do you do some version of all of that?
Yeah, there's some variation, but by and large, direct primary care is just one fee for everything. Um,
Okay.
you can add on some additional services. Some people will do different procedures, you know, um, cosmetology services. There are things that are added, but
Hmm.
in general, patients are paying a low monthly subscription, 60, 70, $80 per month on average. And so they're getting everything that you do for that. So it's amazing what people, pay for things that are important to them. I mean, grooming their dog and, doing all kinds of things, their cell phone bills. We spend money on the things that are important to us. And so I haven't seen any hesitancy for patients once they realize the value of the data. They the cost is not an obstacle. So a lot of your patients have these metabolic conditions and really need to be monitored 4 times a year. And if everybody's doing it at least once a year, even so yeah, it's just I can't be more clear on that. The value of it for the patient, they're willing to do that, and so the revenue that you generate, it's not an obstacle. You can always break even, cover the costs, and you know, and then some, depending on how you build the model.
I love to hear that. And you're actually kind of convincing me maybe I need to get my own DPC provider for my own care. I think that's actually, I mean, even at that price point, like you said, that's less than I pay for grooming of my yard every month, and that is much less important to me than my health.
Yeah, yeah. We commonly talk to people about the cost of not having a DPC doctor. All the copays, and you know the tests that you end up having done because you couldn't get in with your doctor and they sent you to a specialist for everything. And I mean, actually, for most people, the cost of not having a DPC doctor is greater than what they actually pay to have one. So, yeah.
Yeah. Do you see people have both, like some engagement with the traditional model, or is it really kind of a one or the other?
Well, they have full engagement with the entire healthcare system outside of primary care using their insurance, but they don't have two primary care doctors. We have a very small percentage of people who have an HMO, and they have to keep their primary care doctor in case they need referrals. But that's the exception to the rule. Most of those types of insurances are going away. So people decide I'm either going to keep my regular primary care doctor, who I can never get in with and who spends 10 minutes with me, or this model sounds great because it's a low fixed monthly cost and I have 24/7 access, and this doctor actually cares about helping me be healthy. So
Yeah.
most people can't afford not to have a DPC doctor.
I mean, I'm pretty much sold. So I think I think we definitely have a lot of opportunity to see this grow and take that 9,000 and quadruple it, I bet.
Yeah,
Here shortly.
we're on the steep part of the curve now.
Well, that's great. Well, yeah. So thank you so much. I really appreciate your feedback. And you said everything that I couldn't, you said it better than I could say, and really hearing how valuable it is in your practice really makes me even more committed to continuing this work with Sika and with Body Comp. So appreciate your time today and hope that you and the Sika sales team have a good time in Colorado if you guys get to meet up. And I look forward to hearing how that conference goes and any new insights that you have that might be relevant to us.
Likewise, I've enjoyed the conversation.
Thank you so much. We'll talk to you soon.
Okay, bye.
Bye.